Dear student, I am going to discuss about distribution, all the factors which are affecting distribution. I already covered what is distribution, how the distribution is working, what are the factors which are affecting distribution. In that I already covered three main factors, that is lipophilicity, capillary permeability, and the blood flow related factors. And the main topics and the main factors which are affecting the distribution more predominantly, that are protein binding, reabsorption or redistribution, and bioavailability, that I already told that today I will discuss. I am requesting you, before going to that factors, you have to study first factors which are I already covered into distribution part 1. So before starting distribution part 2 and to understand better that part, please go and check it out, the part 1 video that I already covered about distribution. That link is already given into the description. Okay, so straightforward to that topic, or to the factors which are affecting distribution. Protein binding. Student, please hear carefully. That is the important topic you have to remember. And if you have any doubt, please ask me. Previous classes also I told that for next topics it is most important. So to understand all these things, you have to listen carefully. And if you have any doubt, please ask me into comment sector. I will try to reply all, and I will try to clear it into the next classes. So protein binding. We know when we are sending any drug into our body. In our body, main parts are lipid, and after lipid, if any organ is most constituents of that is protein. And drug, how it will act in our body, that all depends upon different proteins which are available into our blood or into our body. So, according to how it is binding, that drug is binding with proteins or not, how it is affecting, how it is going to affect the distribution, what will affect if protein is bounded to drug, if protein is non-bounded to drug, that I am going to discuss now. So the thing is, drug can be two part after absorption. One will be bounded with protein, and another one is non-bounded, that we call as free protein. Drug can be present in our body in two forms. One is protein bound form, or second one is non-protein bound, what we call as free drug. So depending upon how protein is binding or non-binding, drug distribution is affected by that. I am going to tell you how it is going to. Let's just suppose drug is bound to protein, and you have to remember, in our body most of the acidic drug, they are bounded to albumin protein, and the basic drugs, they are related to glycoprotein, they are binded to glycoprotein. So you have to remember that acidic drug always bound with albumin, and that basic drug always bound with glycoprotein. But you have to remember also that whichever drug which are bounded to proteins, they have less distribution in the blood. I am telling how it is related to. Let's suppose one drug is bounded to protein into a capillary. So here I will discuss how it is related to previous what I have covered, blood flow, capillaries and all these things. You just suppose in one organ, in organ, drug is bounded to protein. Now that drug plus protein, they have to pass through that small capillary, that capillary junction. Just suppose if that drug is bounded to protein, that means that drug side first it was like that. When the protein is connecting, then the size is coming overall big. So that if that size is macromolecular size is coming bigger, that means it will not pass easily through that capillary. If the size is bigger and the capillary is less or tight junction, that means drug which is binding to the protein and become macromolecular, they can't pass that. So what it will happen in that tissue, that blood flow will be less, that drug can't be more flow through the capillary, so the drug distribution will be less. Now if suppose that drug is not bounded to protein, that means if the drug is free form drug or protein non-bounded drug, then what it will happen. That is one capillary. Now only drug is there. There is no protein bounding. So that size is less, molecular weight is less. That means that drug can be easily flow through that capillary. If that drug is can flow through the capillary, that can present into they can go into the tissue. In the tissue, bioavailability of the drug will be more. Then the drug carried by the blood will be more, and the drug distribution is more. So here we can easily see that capillary, blood flow and lipophilicity, what I have covered as a factors affecting distribution, they all are connected to protein bounding also. By that I can easily tell you and you can easily understand how they are connected. So I am just summarizing all these things about protein binding. What we have to remember, if the drug is bounded to protein, that means they can't pass through the small capillaries. That means their bioavailability in this tissue will be less. Then their drug by the blood will be less and drug distribution will be less. And if the drug is free from, that means they are not connected to proteins. That means their bioavailability in that cell will be more. Drug by blood flow will be more and drug distribution is more. That means protein bonding is inversely proportional to the distribution. If one drug is bounded to the protein, then for that drug distribution in a tissue will be less. If the drug is not protein bounded, if the drug is free, that means their bioavailability in a tissue or in a cell will be more. Drug distribution by the blood will be more, and that distribution of the drug in that specific tissue will be more. This is how that drug is related to protein, how drug protein connection will affect the distribution. Next topic what I am going to cover on next factor, that is bioavailability. That I already have told here, bioavailability, but you have to remember what is bioavailability. What is bioavailability? What I have already discussed in protein binding. So before going to that, I am again repeating, if you have any problem in protein binding, just comment it below. I have to clear it because protein binding and bioavailability is related. Somehow I told every factors are related to each other. Like that, bioavailability and protein binding also each other. So if you have problem in protein binding, just tell me. I will clear it. Then I will go forward for bioavailability. Next part is bioavailability. That is related to protein binding, that I already covered. Bioavailability. What is the bioavailability? When we are taking any drug into our body, that drug is reaching into that different tissues, but they are not same as how much we are taking into our body, not that much. I am trying to tell. Just think we are taking a drug 500 mg. That is reaches to kidney for it to work, let's suppose. But in kidney, that whole 500 mg will not go. In that pathway, different usage will be there, metabolism will be there, everything will be there. Some part will be excreted out also. Out of that 500 mg in kidney, only just suppose 550 mg will reach. So in kidney, out of the 500 gram mg of drug, only 50 mg of drug is reaching into that kidney tissue. So in that kidney tissue, viability will be drug amount present in that organ, that means here is 50 mg, and the total drug that is administered, that means that is plasma drug concentration of drug, that is 500 mg. So here it will be 0.1. So in kidney, in this case, bioavailability is 0.1. So this is the main thing, what is bioavailability. That means bioavailability, how much the drug we are taking, means how much the drug concentration we are absorbing. That means drug plasma concentration, how much we are taking the drug and how much it is reaching to that specific organ or specific site. That is the bioavailability of that specific site. And bioavailability is denoted by F. So that F we can tell drug concentration in a specific organ or tissue divided by total drug plasma concentration. Like I already discussed in kidney, bioavailability only 50 gram in specific organ, that means here I am telling in kidney. Total drug plasma, that means how much total drug we are taking, that is 500 mg. So in that kidney, that bioavailability will be 0.1. That is the mean of bioavailability that you will study in your another subject which is very important in pharmacy, that is pharmacokinetics and biopharmaceutics. In that different DRCs are there. Into that you have to study what is AUC, what is drug. According to that also different formulas are there. AUC by T bioavailability. Then VD is equal to X by C. All that equations are there. That is not part of pharmacology. That is part of biopharmaceutics and pharmacokinetics that you will study in different subjects. If you have any problem, you can ask me. I will discuss about all these things. If you have interest to learn all these things, I will take a separate video. I will take a separate class. In that I will explain about all these things. So here it is end about bioavailability. Last and final factors which are going to affect that distribution is that specificity. Specificity is not a factor, that is like a preference or like a affinity. Like you just suppose you are a person, I am a person, you are liking one girl or I am liking one girl, that is different thing, that is specificity. What you are liking or what I am liking, that is different. It may be you are liking any quality of a thing or one of a human, and I am finding any other personality or any other things in any other human or person. Like that, different likes, dislikes, affinities are there. Like that, different drugs are there. They have specific affinity towards different binding site or different action site. However, how much or how amount or how you are taking the drug, it doesn't matter. They have affinity towards specific organ. They will directly absorbed by that organ and they will stay there, and their distribution will be more in that specific organ only. Like I can tell some example like benzodiazepine. Benzodiazepine, that I will tell you into antipsychotic and anti sedative and hypnotic, when I will go in details of different classifications of different specific drugs. There I will study benzodiazepine. This is a class of drug which are taking treating for antipsychotic. Just remember that thing. How it is working, everything I will discuss all drugs in next classes or in next topics when we are coming and we are discussing about different classifications of different drugs of different categories of drugs. Benzodiazepine, they have more affinity towards adipose tissue. So in adipose tissue, their distribution will be more. Like that, other example is chloroquine that we are taking for malaria. That is generally prepared in the retina. So in retina, distribution will be more in case of chloroquine. Another example is different drugs which have iodine in that as a active ingredient. That iodine rich drugs, they generally prefer thyroid gland. So in thyroid gland, their distribution or their preference will be more. They have specific affinity towards thyroid only. So that is also a topic, that is affinity. According to their disliking and liking, they will bind or they will stay or they will distribute it into specific organ. Example I told, like antipsychotic benzodiazepine, they like adipose tissue. So adipose tissue distribution will be more for their chloroquine that we are taking for anti-malarial drug, that will prepare retina. So in retina their distribution will be more. And another one is iodine rich different drugs are there which are going to distribute it more or they are preparing towards thyroid or thyroid gland. So in that their bioavailability more, that is the specific. By that I have already covered different factors which are going to affect distribution of a drug. The next thing I will go for a term, that is redistribution. The last thing in distribution, one term, that is redistribution, that we have to study. Just suppose that is a drug. First thing, that drug will pass through distribution. In distribution, I have told it will reach into different tissues, cells, different organ, all these things. First thing, they will go into high perfused rated organs, that are kidney, brain, liver, and all other important organs. So by the distribution, the drug will reach into that high perfused drug. After reaching into the high perfused drug, they will show their mechanism of action, their other work, their binding, their distribution, everything. After finishing of their working, they will leave that part. Then they will go and they will distribute it in less perfused tissue. Less perfused tissue. This perfused tissue like adipose, skeletal muscle, fat tissue, etc. That method is called as redistribution. So in distribution, drug first will go to high perfused organs, that are kidney, blood, brain, all these things. After that, that will reach into the low perfused organs like adipose tissue, skeletal muscle, fat tissue, etc. So the travel of drug from administration area to that high perfused rated organs like kidney, brain, and liver, that mechanism is called as distribution. After showing their mechanism of action and everything, when they are leaving that organ and they are going to that less perfused organs like adipose tissue, skeletal muscle, and fat tissue, that process is called as redistribution. So that is the last thing. What is remaining into that redistribution? By that I already covered all the distribution topics, all the factors are affecting distribution. By that class, I easily have covered all that important things what you have to remember into distribution part without using that much hard or boring theory topic. Just by simple explanation, I have covered that distribution part so that you can easily understand, and that I also tried not to use that much boring theory so that you can easily understand and you don't have get bored. So I'll tell you to study distribution part 2 that I am covering now. Before that, study distribution 1, and before studying distribution 3, prefer to add absorption part 1 and absorption part 2 videos so that you can understand all these things. And in next class I am going to explain about uh, elimination and metabolism of drug. Then you can study all that together and you can understand whole pharmacokinetics topic. So today for now, please go and check it out, distribution part 1 and part 2, absorption part 1 and part 2. All that links are given below into the description, or you can go and search my YouTube channel Pharmacodiaries. There you can see all the topics what I have already covered about general pharmacology, pharmacokinetics, absorption, distribution, and next I will cover other things, and then I will go through different classes of drug, all these things what you are generally is required for the B Pharm. Thank you.